But here's the thing, like, and this is what people hardly ever talk about. When you're elderly and fragile, or you have multiple chronic diseases, you get a rhinovirus, you get a
common cold
virus. It could throw you into a spiral that can kill you.
Yes.
We don't lock you down. We don't mask you. We don't do all these things to reduce your joy. We say this is part of getting old, and this may be the thing that tips, and then we treat it as we can with supportive care. But with COVID, we've done the opposite. We're like, no, this is COVID that killed you.
Exactly. It's really interesting because I keep on thinking to myself when I saw my dad get COVID.
My dad got it too.
Through it,
in a very
it was
he's
fine.
83.
Very frail, but was absolutely fine because he had tools.
Yeah.
I keep on thinking not almost. I'd rather him get SARS-CoV-2 where I can give him an antiviral than rhinovirus where he's very, very frail and there's no tools.
There's nothing you can do.
So the other aspect of that book is in HIV, we celebrated tools. We celebrated biomedical advances. When we got antiretrovirals, we said, this is so great. And like, actually, you can't pass it on after antiretrovirals and, you know, no condoms and no need and like undetectable because untransmittable and go and live your life and you're going to have a normal lifespan. And all we did was reassure people. But doctors didn't reassure people during COVID-19 that these vaccines worked really well if you're older and that natural immunity worked well and and T cells and B cells worked. They didn't reassure people. They went into the scare tactic. And I don't understand that because it feels like doctors part of our job is reassurance that biomedical tools work. Otherwise, why would you take that biomedical tool?
Yeah.
And I think we decrease vaccination rates even of COVID, not just routine childhood vaccinations, but people were like, wait, I have still to mask. Why am I going to take this vaccine?
And this is something Paul Offit has said again and again and again, is our messaging on this has been totally backwards to what's actually happening, what's true about the vaccine. Like, it's one thing to say, oh, you know, we should message in a way that like encourages the right behavior. No. Let's message in the way that's actually correct. It's true. It's fact. So, okay, it doesn't prevent infection, but it prevents severe disease.
Which is why we developed a vaccine to begin with.
That's why
because common cold coronaviruses, we haven't developed a vaccine.
Because
we're like, it's a cold.
Right.
So we
have enough collective B and T cell immunity among human populations that we don't die of it.
Yes.
Now, if you go back in time and you give it to a Native American population that's never seen it, they're going to get like COVID-like pneumonia. They're going to die.
From a mild cold coronavirus. And that's the thing about immunity. Immunity works. And that's the thing about this conversation piece that I'm going to send to you, if you can post, that it said, unfortunately, immunity is the only way through a pandemic.
Yeah.
And
you've been saying that consistently.
Very consistently. But people who think that masking and avoiding infection and avoiding human beings and being so and telling people that they're awful for breathing and whatever we did, that the only way through a pandemic is immunity. And we believed that in 1918. But somehow we lost a conception of immunity because it was political, I guess, in 2020. And everything became political. Everything was some people were modeling after China's approach, which was very autocratic, like you said. And then some people were modeling after Sweden's approach, like Florida was more Sweden's approach. And at the end, it was all about immunity. It didn't matter. It all came out in the wash, except for the diseases of despair, which were more in populations that shut down.